Okay, here we are for another episode of the YVI, introducing our speaker and our YVI community, which is Youth Veterinarian Initiative. That's what YVI stands for. And I'm really excited today because we have a different kind of veterinarian on today that I can't wait to speak to also. We also have some special young guests that we haven't had on before. And so I'm excited to later find out who they are and introduce them to our YVI community that may not be on with us live today. In addition to that, we've got our very special co-host coming to you all the way from Paris, France, and she's like 9 hours ahead of us, Dr. Monique Wells, who is also a veterinary pathologist. Monique, say hello.
Hello, hello, hello. I've been chatting everybody up, waiting for you to come back from letting the chickens out and getting Pat all set up with her computers.
Yes, I want some of those fresh eggs.
Oh my gosh. And you know what? That's why I had to start letting them out so late. I was letting them out at 7. I had fewer eggs. Come to find out, they were laying them everywhere. So I was having Easter egg hunts every day. And so I had to start letting them out at 10, and now they lay in the coop. And because they started laying in the coop more, even some that lay later, they go back to the coop. And so I've got them on a regimen. And so with YVI starting at 10 our time, I was trying to wait as late as possible and then got on the phone. So I was like, oh, stop. But thank you, Dr. White, for being on. You know, I was going to read your bio, but I would like for you to just kind of give us your history and what brought you into this arena of veterinary medicine. So let's just start with you, Dr. Patricia White, and thank you for being on.
All right, well, it's my pleasure. I'm gonna, you know, if you don't mind, I'm gonna start my talk, and if I can figure out how to share the screen.
I'm making it available right now.
You can see share screen at the bottom. Can you see it in the middle?
Hold on. It says host disabled participant screen sharing. So
I just made you co-host.
Did you? Okay. Let me try it again. All right, there we go.
And Dr. White, before you begin, I just want to also introduce Danielle Corbin, who has become such a significant part of YVI, and it's because of her that our YVI program is also a part of the curriculum in the Bronx, New York. And so Danielle, thank you for being on and being such a great part of YVI and the growth of our community.
Yes. You're welcome, it's a pleasure.
Yeah, hi, how are you?
All right, and yourself, it's a pleasure to meet you.
Yeah, pleasure to meet you. I am Dr. Pat White. I've known Dr. Wells for a whole lot of years. We were together years ago at The Ohio State University. She was pursuing her pathology path and I was pursuing my dermatology path. And it's amazing. You know, the world is very small and we are all connected, and it's amazing how we've come back together in this beautiful and unique way. I have had an interesting path, I think. Veterinary dermatology just came to me, and I'm assuming that it was supposed to come to me. I am one of those folks who always wanted to be a veterinarian. So as a small child, I can remember my mom telling this story of me. I was born in Oklahoma. My dad was in the military, and I guess one day I was a toddler and we were outside on a picnic, and apparently there was a herd of buffalo in the distance that caught my eye, and I went careening toward this herd of buffalo, and as my mom gasped and screamed, my dad went tearing after me to bring me back to the fold, and I couldn't figure out what all the fuss was about. You know, it's buffalo, they're little fuzzy animals. I want to touch them. I want to be there. And so my beginning began even before I knew that there was anything such as this career of veterinary medicine. And you know, growing up, we always had a dog. Boxers were our pets, and this is me and my brother with Trouble. Trouble was our one of our first boxers, and she was Trouble. But I was the one who always knew when there was something going on with her, you know, and I was always the one to treat her when she was sick and give her her pills. Nobody else could make her take her medicine the way I could. So there was always an affinity toward animals and toward healing. My mom tells another story when we were in Germany and we were on vacation at a place called Berchtesgaden, and there's this huge lake at Berchtesgaden, and apparently I'd gone off to play around the lake, and I spent hours chasing this giant frog. I was determined to capture this frog, and I did. And my mom said that as I held this frog, its legs hung down about this far below my small hands, but I brought it into the hotel, just excited about, oh, look what I got, this frog, this great frog. And my mom, being the person that she is, she was like, oh, that's really nice, sweetheart, but let's take him outside and let him free. He's gonna be happier as a, you know, so I'm telling these stories just to say that being on this path and pursuing this career clearly was what I was meant to do, even though as I grew older and went through the process, I veered away from veterinary medicine. So my journey has been interesting. You know, I went to and got my undergraduate degree from the University of Georgia, and UGA has a really great veterinary school. But when I completed my veterinary training, when I completed my undergraduate training, I did not want to go to vet school, and I didn't want to go to the University of Georgia. And the young people on this call probably won't get this, but part of the reason why was the way I was treated as a Black student at UGA, that I didn't want to pursue a career in an area that I wanted to pursue in an environment that didn't want me there. So I went and got a big girl job. I graduated from undergraduate school and got a job in Atlanta and worked there for about a year, just long enough for me to figure out that that probably wasn't what I wanted to do. So I went through the process of applying for veterinary school. I applied to both the University of Georgia and Tuskegee, and I got into both. And I wanted to go to Tuskegee. I wanted to be a part of that legacy. I wanted to be a part of what Tuskegee really means to the African-American community. And I have never looked back. That was one of the best experiences I had in academia, in being in an environment that nurtured me as a human being, as well as someone who wanted to pursue a career in veterinary medicine. So it's interesting though, because during my time at Tuskegee, I wanted to be a pathologist like Dr. Wells. Ooh. You know, so during my clinical years, I really didn't pay that much attention to clinical medicine the way one would if one were going to pursue a clinical career. And I didn't really get bitten again by, and I think it's because the mentors that I had at Tuskegee were pathologists. They were really amazing teachers and wonderful role models. So finding a role model that supports you and nurtures you is important. So I'm saying that here for the young folks on the call, because mentorship is really, really important. But between my third and fourth year in veterinary school, I worked during the summer at an emergency clinic. And I worked with another African-American. I was lucky. I had several African-American veterinarians as mentors, even as early as the early 70s, which was almost unheard of at that time. So this woman was also African-American. She was a graduate of Washington State University's veterinary, and working with her for the summer in a clinic, it just opened my eyes in a different way to clinical medicine. It was exciting and interesting and fun. So I go back to veterinary school for my last year, and I have to pivot, and I don't know how. And there was a woman at Michigan State University, her name is Pat Lowry, who became my next mentor. And she had sort of directed me toward an internship. And I got matched at an internship at Michigan State in small animal clinical medicine. And, you know, that was 13 months of drinking from a fire hose in terms of learning about veterinary medicine. So it was the best and the worst of times. Again, during a time when being African American in the veterinary field was an oddity. And at Michigan State, again, it was a challenge to be there. And what I learned there that served me for the rest of my career and continues to serve me today is that no one is going to stand up for you if you don't stand up for yourself, that you deserve to be wherever you choose to be, pursuing whatever you want to pursue, that you deserve to be treated with respect by your teachers, by your colleagues, and by the students that you teach. It does not matter what they think of you, but you have to command that respect. And, you know, I went into that environment very timid, knowing that I didn't know a lot. And it was a challenge finding my footing. But when I did, and I demanded that people treat me with respect, my entire experience there changed. I was determined that I was going to learn as much as I could in those 13 months to serve me in being a better veterinarian. So even though I learned all of this information about veterinary medicine, what I learned about myself and how to interact with people who don't value me was probably more important than that training. So when I finished my internship, I was exhausted, you know, dealing with that stuff was exhausting. And so I got a job as a clinician at a clinic in New Jersey, but chose instead to go back to Tuskegee to be an instructor there because I wanted to give back. I'd learned so much in that short year that I wanted to bring some of that back to Tuskegee. So I was at Tuskegee for 2 years. I pursued my residency in dermatology at that time. And the first year I applied for my residency, I learned dermatology was a brand new specialty at the time. And if folks didn't know who you weren't going to get a residency. So the first year, nobody knew who I was. There was no dermatologist at Tuskegee. There was no one to sort of pave that path for me. So I spent a year teaching dermatology and internal medicine at Tuskegee and spending time at Auburn University with the 2 dermatologists there, getting them to know who I was and learning more about the field.
So Pat, can I interrupt you just for a sec? So just tell the audience, because particularly for the young kids, tell them where Tuskegee is and where Auburn is so that they can.
So, and thank you, Dr. Wells, because Tuskegee University is in Alabama. And Tuskegee University is a historically Black college and university. And it's the only Black university that has a College of Veterinary Medicine. Auburn University is also in Alabama. It's about 30 minutes from Tuskegee. And the whole beginnings of schools like the veterinary school at Tuskegee and the School of Architecture at Tuskegee, et cetera, are there because of the lack of opportunity at other universities in the country. So Auburn University is a neighbor of Tuskegee. They are, and they both have veterinary schools. The only state that for this length of time has had 2 colleges of veterinary medicine in the same state. And at the time that I applied for veterinary school, there were only 28 colleges of veterinary medicine in the country. So imagine there being 2 in one state. But being in that space of being able to learn from these dermatologists at Auburn and to bring that knowledge back to Tuskegee while I was teaching, I think was a really special opportunity for me to share what I was learning as I was learning it. But when I applied for my residency the second time, I applied to 4 universities. I matched at all of them, but I got my first choice, and that was Ohio State. I was their first dermatology resident. They had never had a residency train. I was the first person to enter their residency training program. They'd never had that training at Ohio State. So I was really pleased that I was chosen to be there, and I had great mentors there. It was a really good experience. So I got my master's degree there, and I did a postdoc fellowship with for 2 years after that. So I was at OSU for 5 years total, and everybody thought I was going to go into research because of the length of time that I spent doing research. And I was like, yeah, nah, I really, really like clinical medicine. And my brother really gave me some really good advice, because he was like, aren't you tired of school? Aren't you ready to give that stuff up? And, he said, why don't you? I said, yeah, but I don't know where to go or what to do. And he said, why don't you choose where you want to live? Because you will be happy there and you will be successful in whatever you do. So just make a choice for yourself for a change. So I moved to Atlanta, and I opened Atlanta Veterinary Skin and Allergy Clinic in 1992. I received my board certification in 1993, and I was the first person of color and the first African-American to be certified in this specialty. So another honor and something that I'm happy and hopeful to share. Now there are, I think, 4 board certified African-Americans.
Dr. White,
my legacy.
White, if I can interrupt before you move forward. We've talked a lot, we've used the word a lot, dermatology, in starting. And then you just spoke about skin. Can you go, you'll probably talk about it later, but I don't want our younger community, I want them to understand dermatology.
All right, so dermatology is a word that means skin, the study of skin, the science of skin. And in veterinary medicine, dermatology encompasses everything that's on the outside of the body. So with our patients, we have to deal with the fur and the skin. It also encompasses the ears, because the ear canals are lined with skin. And it includes the paws and the claws, because the nails, the claws, come from or is made by the skin, for a really simple way of describing it. So dermatology is the study and the medicine and the treatment of conditions of the skin, fur, ears, and nails. So a lot of folks ask me, dermatology, can you make a living doing that? It's like, oh yeah, I've been doing it for 30 years. So yeah, and if you look at some of the information that's available about statistics in terms of the frequency and number of conditions that pets go to veterinary clinics for, probably between 50 to 70% of those patients present with complaints, if they're sick, complaints of the skin and coat. So it is probably the most common complaint that pet owners have that take them to their general practice vet. And as a specialist, what I see or what I deal with are really conditions that the general practitioner has had a difficult time managing, or it's been going on for so long that someone needs to intervene to really get to the cause of the issue. So as a specialist, and I think that's true for ophthalmology and internal medicine, that as specialists, we deal with sick animals. All of our patients are sick. So we don't get the cute, warm, fuzzy kittens and puppies that general practitioners get to see on a daily basis, unless they're really sick, and that can be sad. A lot of the conditions are chronic and require long-term management. So a lot of what I do is teach pet owners how to recognize and manage those conditions for the life of their pet to improve the quality of the life of their pet.
Dr. White, can you tell our audience what chronic means?
Chronic means going on for a long time. So if you get a cold, that's usually acute. You have the sneezes and sniffles for about a week and then you're better, right? But there are some conditions that you get that don't go away, even with medicine, that they stay around for a long time. And then, so if you're a young person and you've suffered with asthma or you've suffered with any kind of allergies, those are the types of patients that I see, and those are the types of patients that I treat.
Okay. And animals can get asthma and allergies just like people?
Animals can get asthma and allergies just like people. In fact, animals can get any condition that humans get.
Okay.
Any. Any condition.
And you know, and so often we don't think about that. We just
No, we don't. And a lot of people are surprised when I talk about the patients that I see. Allergies are probably the lion's share of what I see. I see a lot of pets with allergies, but I see a lot of pets that have cancer, that have diseases that affect the immune system, that are associated with birth defects, that are associated with hormonal imbalance. So many different parasites are common, and that's something that people don't get as much is problems associated with parasites. But a lot of what I do is comparative. So a lot of times when I say comparative, it means that I have to know about conditions in humans as well as in animals in order to recognize and treat them, and also to know whether what that pet has could potentially affect a human in that family. So there are some conditions that are contagious that people can catch from their pet. And I have to be able to know what that looks like and be able to ask people questions that help me know whether that's something that we need to consider. And you have to be very delicate with how you ask those kinds of questions.
Yes.
But it's a part of what I do. So we talked about what is a veterinary dermatologist, 4 years of veterinary school, and then you have to do training, you have to take a class, a test, and pass a test, and then you get your diplomate status. And as of 2022, there are just 328 veterinarians worldwide that have this certification. So it's a small college. There are a lot of people that have an interest in veterinary dermatology, but not many board certified folks. This is something for older kids to know about in terms of the different opportunities to learn more about veterinary dermatology as you get ready to go to college and you are looking for those kinds of exposures to let you know whether that's something that you want to do. But the skin is the largest organ of the body. It's the first line of defense against acquired diseases. So it protects our bodies from the outside world. It keeps us from getting sick inside. But it also can be a way to signal that there's something going wrong internally. So the skin can also reflect bad stuff going on inside. So in my specialty, I have to know about internal disease and what goes on inside and how it can impact the skin, so that when an animal comes into me, from the history from the owner, from the notes from the general practice vet, and my examination of the patient, I can decide whether it's maybe something internal versus something that's coming from the outside. So I talked about similar conditions between people and animals, and then the things that can be unique are associated with their anatomy, what's happening. And you know, animals have fur and they have claws. We have nails, you know, and so our nails are very similar to dogs and cats' claws. It comes from the skin. So it's part of the skin. When there's disease of the nails, it's a dermatologic problem. So here are some of my patients. They come in and oftentimes they're very uncomfortable. So their owners put these devices on them to keep them from licking and chewing and biting and scratching themselves, trying to relieve their discomfort. These are my clients. These are the folks that really love these pets and they want their quality of life to be restored. And that's why they bring them to me. So I'm a referral practice. And what that means is general practice vets send their really hard cases to me to try to fix. We provide a state-of-the-art specialized care for companion animals. So I just see dogs and cats. I've seen birds and gerbils and guinea pigs, and I've seen a couple of pot-bellied pigs over the years. But all of my patients are pets. I've seen a few horses over the years. But we diagnose and treat any and all dermatologic or skin-related problems in companion animals. I love the challenge of solving the mystery. So dermatology is one of those things where you can't do a test and make a diagnosis necessarily. You have to use your skills of putting a puzzle together. And I think that's what makes it fun. So this is one of my patients. I'm going to show you some patients that I've seen. This is an old dog that came to me and he had this going on his tummy and his inner thighs. And we had to figure out what was going on with him. And he ended up having a disease that was an autoimmune disease. And that meant that his immune system had turned against him. So our immune system helps us fight off infections and diseases, but sometimes something goes wrong and our immune system turns against our own tissue. And that's what had happened in this patient. So we had to figure out what was going on and stop it. There are drugs that can stop it, but what's even better is to see if you can identify the cause and get rid of that so that the drugs aren't necessary. And what we found out in this dog was that he was allergic to something in his food.
Oh, wow.
That is unusual. I will say that as a cause is unusual and took a whole lot of puzzle solving to figure it out. But once we did, it was fine. And the owner was willing. I said, you know, this is really unusual. This just doesn't make a whole lot of sense. Would you reintroduce this food and see if his signs come back? And he did. So, you know, as long as I've been in this specialty, I still continue to learn something new every day. But in this kind of situation, the only way to know what's going on is to do a skin biopsy. And this is a biopsy punch instrument we use to take a piece of skin and I put it in a solution to fix it. And then I send it to somebody like Dr. Wells to make a diagnosis for me. So I have to have a pathologist look at these skin samples, tell me what the diagnosis is so that I know how to treat this pet. this is a dog. This is a West Highland White Terrier. And this dog had pollen allergies and had pollen allergies for so long that it had caused him to lose all of his hair and for his skin to turn into elephant-looking skin.
Mm.
So we did an allergy test and we treated his secondary infections and we got him to grow his fur back.
Wow.
So this is one of those chronic cases where the long-term effects of the allergies cause this damage. And this dog is miserable. You can tell how he's holding his head, how uncomfortable he is, and how much happier he is
Over here,
now that
yeah.
we've taken care of the problem.
That's super.
This is what we do to identify what the animals are allergic to. We do what's called an intradermal allergy test, and it's a prick test, very much like you do in humans. And when we do this test, all of these red bumps are positive reactions to different things. So I test for pollens and molds and insects. There's a whole battery of things that I test for. But based on these reactions, I can then make an allergy vaccine, and pets go on allergy vaccines and the vaccines help make them better. So it's just like humans that take allergy shots for their allergies, dogs and cats take allergy shots for their allergies.
Dr. White, can you explain that bottom photo?
Let's see if I can go back.
Oh, then if
This
you
one?
can't, that's okay.
I can.
Yeah, that
So
bottom photo. What?
Photo up here at the top is where we're making the injections under the skin.
Okay.
And you wait about 5 minutes and you wait for this to happen. So right here, you see that there's nothing there. That's a negative reaction. So underneath these, I inject above and below the dots. This dot has nothing above it or below it. So those two things are negative. Each one of these is something different. So we might have ragweed pollen and fescue grass and oak pollen, you know, and so I test for all of these different things. I have a panel, a sheet, and I go through and I give them a score, and it might be 0, it may be 1, 2, 3. Those big red ones were 4 pluses. It can't get any stronger than that. So that animal was allergic to a lot of different things.
I've always wondered how do they find out what they were actually allergic to? And so, that explains it. All right.
Yep. There are some blood allergy tests too, but the skin test is the gold standard.
Okay.
And a lot more accurate. So the other thing that animals get are infections of the skin. And so seeing this dog come in, he could have all kinds of things going on. He could have a bacterial skin infection. He could have a fungal infection, which is what ringworm is actually a fungal infection. It's not a worm. It's a fungus that affects the skin, and it can affect people as well. So it's important to identify if that's what it is. But we identified that he had a fungal infection, and we got him treated, and he grew his hair back. So, you know, that's one of those that humans can catch from their dog? Yes, correct.
Ah, thank you.
Yeah. So it doesn't always look this bad. So I picked some really bad pictures to show you, but it is something that we have to look for. And then of course we have to look, this is an ear canal right here. Is a close-up of an ear canal. And we look for parasites on the skin. So that previous slide, we would have looked for parasites. In the ear canal, we look for parasites. And if we take a sample with a swab, look at it, put it on a slide and look at it under the microscope, and we look for bugs. And if bugs are there, that's our diagnosis. And now we know what we have to treat. So, sorry about that. Let's see. So this is a mite called Demodex, and they're different shapes and sizes. Now we know that there are all kinds of Demodex mites, but they can cause a lot of fur loss, like we saw with that little dachshund. It can lead to secondary skin infections, and you know, we need to know what's going on in order to treat them. We see deep tissue infections as well, and identifying what type of bacteria or fungus or whatever is causing that infection is important in order to know how to treat it. So you have this big open wound, you can try to treat it with all kinds of things, but unless you know what's there, you don't know what's going to clear it up. And so this was another chronic condition, something that had been going on for a long time, that required that we identify what the cause was and then put medications in place to clear it up. And so this is the kitty cat after we've cleared up that infection and allowed that wound to heal. So these are just examples of what I do. This is a dog, 2 different dogs with ear disease. And that's really common. Dogs will have stinky ears and stuff pouring out of their ears, and you know, medications are tried to treat it, but it keeps coming back. And so my job is to identify why those ears are that way, so that we can not only clear up the infection that's there, but keep it from coming back, because these conditions will keep coming back if you don't identify the cause. So that's part of what I do. So here I am looking at a dog's ear canal. This is my video otoscope, and what it does is it allows me to put this probe in the dog's ear and then blow up on a screen what I'm looking at, so I can see it really big rather than really tiny. And it helps me see really the structures of the ear canal and what may be going on deep in the canal. So this is a normal anatomy of a dog's ear. There's hair that grows in the ear canal. Like I said, the ear canal is lined by skin, so it's very much like the arm or the leg. It's different, but it's similar. And so when disease goes on in here, I need to know what it looks like. This is a dog's eardrum. And so when we're looking in the ear canal, we want to know what the skin looks like, but we also want to see if the eardrum has been damaged in any way. So I look for normal anatomy, and if it's not abnormal, like this one, there was this, it's actually pus, y'all, which is gross, but that was what was in the ear. You can see this fluid that's down in the ear canal, and I want to know, well, what's underneath it? So my machine lets me remove this material to see what's underneath it, and what was underneath it was a tumor. So this ear is going to continue to have problems and be infected until we remove that tumor. So the educational track for someone who wants to be a veterinary dermatologist, as I described, can be pretty long, because you have to finish high school and go to college and then go to vet school and then do some additional training afterwards. But, you know, if you love what you do, you get to do what you love. And so it's absolutely worthwhile to be sure of what that looks like, because, you know, it's a long road. You need to have good grades so that you can choose the college you want to go to. You need to volunteer, and I absolutely recommend finding somebody that will let you shadow them at their vet practice. If you're interested in science and things under the microscope, you might find somebody who works in a lab and see if they'll let you shadow them there. But you need to get some exposure just to see if it's something that you really think you want to do. Sometimes when you get that exposure, I remember the first time I saw a spay, I think I was about 13, and I got a little lightheaded. I wasn't sure if that was something that I really wanted to do when the doctor started pulling out parts into out of this little dog's abdomen. But I got over it. It was all right. After the first one, it was okay. Then you you need to research the college you might want to attend, because the thing that I want to impress upon you guys is that education isn't just academic. It's not just books and good grades. It's social, and it prepares you for life. So you need to pick a place where you can get a good book education, but you can also get a good social education that prepares you for wherever you go. Whether you decide to continue along a veterinary track or not, it prepares you for life. And the bonus is if you can find a school that has, you know, summer abroad training, or, you know, an opportunity to experience other cultures and expose yourself to the world, that is a bonus for your educational track. Your personal track is that you should have passion for science and medicine, because if you don't, you're not going to be able to withstand the nonsense that they take you through to get you to where you want to be, because there are a lot of courses that sort of weed you out. If you can't do biochemistry, you know, if you don't like physiology, you're probably not going to get to that place of getting into veterinary school. Need to have clarity on your values and your purpose, though, and that's a big thing. But I don't think that that's a concept that you're ever too young to start thinking about. What do you love to do? What makes you happy? What are you good at? How do you make a difference even now if you're 10? What things do people just light up when you share a piece of yourself with them? These are things that are a reflection of who you are, and that will never change no matter how old you are. And it's a reflection of your values and your purpose. Have an idea of how you want to serve. And that's a big statement to make, but again, I don't think you're ever too young to hear that when you choose a vocation that you're passionate about, it's not a job, it's not a paycheck, it is a way that you show up and share something that is fundamentally unique to who you are with other people in the world. And that
Dr. White?
Yes.
We have a question from William.
Yes.
Yeah.
Yes, William.
I actually have 6 questions.
6?
Okay.
Okay.
Do you do animal surgery?
Do I do animal surgery? I sure do. I take off tumors and growths. So, you know, that animal that cat that had that big open wound, we had to do some minor surgery to help that wound to close, and that was surgery. But I don't have to go inside a body cavity, so I don't have to go inside their body. All of the surgery that I do is on the skin or in the ears or on the paws. So
you're not doing heart surgery?
I'm not doing heart surgery, liver surgery, kidney surgery, no internal surgery, no.
We have lots of questions. Go ahead, William.
Do you have mandatory breaks?
Do I have what?
Mandatory breaks.
Mandatory breaks? Is that what you said, William?
Yes.
Do I have mandatory breaks? I'm not sure if I understand what you mean by that, William.
Like, do you have breaks sometimes?
Do I have breaks from work?
Mm-hmm.
Do I take vacation? Yes.
Oh.
Is that what you mean?
Mm-hmm.
Yeah, they're not mandatory. They're what I choose to do.
Oh.
So I love to travel. Like early on, I had a picture of me in China, at the veterinary school in China. Well, that was a combination of work and play. I lectured in veterinary dermatology in China, and I took 10 days and traveled around China and just saw the sights. So the nice thing about, I've had a chance to lecture all around the world. I've been to Dubai, I've been to Ghana, I've been to the Caribbean, you know, and my specialty has allowed me to be able to do those kinds of travels that I might not have been able to do otherwise. I've gotten to share what I love, which is veterinary dermatology, and I've gotten to travel because that's something else that I love to do. I like to scuba dive, I like to go camping, so I take every opportunity to give myself breaks. I don't work all the time.
Well, good, good, good. Now, Dr. White also, now, William, we're going to come back to you. So hold those probably 3 more questions. We've got a few with their hands up. So Gabby, what is your question? Can you come off mute? And then Bailey, I'll come to you, and then Catherine.
Okay, so my question was actually about my dog.
About your dog?
So like, I don't know, yes. So like, I don't know if like he'll do this like when he's bored, but like he'll like be licking like his like paw a lot.
He licks his
like
paw a lot?
Yeah, and then like it's like he licks a lot, so it gets like kind of like burly.
Does it get red and sore?
He's on my lap right now, but not really. Like he'll do it at night, and then sometimes he'll just like, and then I don't know if it's something too much, because then if I'm holding him, then he'll start licking me.
Yeah.
So I don't
Well,
know.
Gabby, let us see
some
him.
dogs just lick to clean themselves, you know, so their paws, they walk outside and they get stuff on their paws, and that's just the way they clean. And if he's doing it just at night and no other time, and the skin isn't red or raw and there's no fur loss, it may just be what he does habitually before he goes to sleep, kind of like you washing your face and brushing your teeth.
Yeah, like it's like mainly at night, but at other times too, but it's always at like the same spot.
It's the same paw. The only thing I can tell you is to have, you know, have your mom take him to the vet and have the paw looked at to make sure there's not something going on, because sometimes licking can be a signal that there's something wrong.
Okay, thank you.
You're welcome.
Gabby, where are you located, and can you show us your baby sitting right there?
Yes, I'm in Frisco, Texas, and this is my dog.
So cute. Thank you for sharing, Gabby.
Thank you. All right. Bailey, what was your question?
My question was, if you had like the dog that was allergic to pollen, so do you make a medicine for him to make him not allergic to pollen, or do you send it to somewhere else where they make the medicine?
That's a really good question. I'm glad you asked that question. And the answer is twofold. We used to make the allergy vaccines in-house. So I would get the different things that the pet is allergic to. There's certain solutions that you can buy that allow you to make a vaccine for the pet. But there are companies that do that as well. So you have to have the test results, and you have to know how to put it together, you know, which is part of what I was trained to do. But I used to make the allergy vaccines at my clinic, and now we have a company do it for our clients.
Wow, that was a great question.
Mm-hmm.
Thank you, Bailey. And Catherine. Oh, Bailey, tell everyone where you are, please.
I am in Houston, Texas.
In Houston.
Thank you, Bailey. All righty, Catherine, come off mute and ask your question, please.
What types of food should you feed your dog to keep their coat shiny and healthy?
What type of food should you feed your dog?
Yeah.
Okay. So, boy, that's a loaded question nowadays. It should be a balanced and complete diet. And it will say that on the dog food bag. So it doesn't matter who the manufacturer is. So there's no brand or type of food that's better than another. But on the bag, manufacturers of pet foods have to meet minimal nutritional requirements to be able to say that the food is nutritionally balanced and complete. So I am an advocate of real food, but I am not an advocate of raw food. So I think that diets that have real food in them are good diets. I think that it's required that the food be balanced and nutritionally complete to be healthy, to meet all of the needs of the pet. I think that omega-3 and omega-6 fatty acids help dogs and cats have less dandruff and shinier coats. And almost every pet food out there nowadays has omega-3 and omega-6 fatty acids added to them.
Good, good. Catherine, thank you for that good question. Adding to, piggybacking off of Catherine's question, if there's, can you give your dog supplements the way we take vitamin A, B, C, that kind of thing?
You can. I think that our pets are luckier than we are because they a lot of times are on commercial pet foods that are nutritionally balanced and complete. So vitamins and minerals typically as additional supplements aren't necessary the way it is with our diets, because we eat whatever we feel like it, and they are often out of balance, because we just eat, we have all these horrible habits of eating junk food and all of that kind of stuff. So if you want to give your pet a multiple vitamin, there's no harm. The interesting thing about vitamin supplements is that most of the time, if you take too much, your body will just get rid of it. You'll eliminate it. And it typically, there's some vitamins that you have to be careful with, but most of them, especially if it's just in a multivitamin, if your body doesn't need it, it'll just get rid of it. Most animals don't need an additional vitamin. If you're doing a home prepared diet, if you're cooking or preparing the food for your pet, you absolutely need to add a multivitamin to make sure that they're getting all the vitamins and minerals that they need. But if they're on a commercial pet food that is nutritionally balanced and complete, and most of the big brand foods are, then a vitamin supplement probably isn't necessary. If there's something wrong with their skin and coat, some investigation probably needs to be made about why that is. It may not be diet. It may be that there's something else going on that needs to be adjusted or fixed in order to reestablish that shiny coat.
Now, I wanted to get back to William's question, but before we do that, did you have more slides you'd like to cover before?
Oh, just a few. We're almost done. Find a minute and explore your options and stay informed. If you're in practice, if you decide to be a dermatologist, there's some choices. You can be in clinical practice. You can stay at a university and teach and do research there, or you can find a position in industry or research like a pharmaceutical company. So all of those arenas, you don't have to just be in practice and be a veterinary dermatologist. So there are lots of options within my specialty that allow you to do things. I tell folks, if you don't like being with people and spending time talking with people, then clinical practice is not what you want to do, regardless of the specialty. Because if you're in practice, people are the main thing that you're treating. The animals are just part of the package. And you've got to be able to communicate with people. So the academia track or the industry track might be better for you. But I want to emphasize, do what you love and love what you do, and you'll be fine, regardless of whether you choose veterinary medicine or not. And for me, I love to scuba dive. So, if I'm not working, then I'm playing somewhere in somebody's ocean. And that's all I have.
That is fantastic.
Outstanding.
Thank you
Go ahead,
so,
Monique.
so much. William, is William still with us?
Yes.
You have some more questions, William?
Yeah.
Go ahead.
Do you have a business partner?
Do I have a business partner? No, I have what's called a boutique practice, which is just me and a small group of support people, my technician, my receptionist. And so right now I do not have a partner. I have over the years had other veterinarians work with me, but I have kept it small and intimate.
Can animals get malaria?
Malaria, can animals? No, that's a disease that I don't think animals can get. You know, it's transmitted by mosquitoes, but that disease is selective for humans. Dogs and cats can get other diseases transmitted by insects, though, like mosquitoes, like heartworm disease. You've probably heard of that. And that is you haven't heard of heartworm disease? Have you heard of heartworm disease? Heartworm disease is a condition that affects primarily dogs, and it's a worm that is transmitted by mosquitoes, by the bite of a mosquito. And so that's the reason why dogs are placed on heartworm prevention medicine. It allows that medicine that they take once a month, kills the baby larvae that are transmitted by mosquitoes to keep them from getting heartworm disease.
What is a spa?
Huh?
What's a spa?
I think she said it was spay.
Oh, what's a spay?
What's a spay? A spay is a surgery that is done to remove the reproductive organs in a female dog.
Oh, wow.
Oh. That's it.
Any more questions, William? Those are all good questions.
Dr. White, I have a question, and I just wanted to also show a picture of it. My dogs ended up getting mange, and let's see, gotta go to my
What kind of
screen here.
mange? Was it sarcoptic mange?
No, and that's the thing. I am not
Was it
sure.
something from your chicken?
I don't know, but I'm going to just show my screen so you guys can, so even the community can see it.
Oh, yeah.
And so the mama, she had puppies, but it ended up affecting her more on the face. And I didn't know what it was at first. I'd never seen it. But because she had puppies, I'm showing you here, this is where Brendo, one of her puppies, because I guess the close contact, her young puppies ended up having it too, and their skin started looking really rough. I didn't know what it was.
Were they itchy?
And you see them, they were itchy, and then it started looking like elephant skin. But now Brendo, as you can see here, Brendo is better and he's all healed. And what I did is I bought some Mange shampoo and started bathing him with it, but I don't even know how dogs get it.
Right. Well, we don't know what kind it is. So you remember the picture that I showed of the cigar-shaped mite that was wiggling on the screen?
Yes.
That's Demodex, and that's possibly the type of mite that they had. And that is a mite that is transmitted from mama to puppies when the puppies nurse. But I tell people all God's creatures got Demodex. We even have Demodex. If you scraped your eyebrow, you'd probably have a mite there.
Oh, God.
Really?
But it's part of the normal, it's part of the normal flora. It's part of the normal population of microscopic bugs that live on skin. They're supposed to be there in very small numbers. But when a mama dog is stressed, like in whelping a litter, her immune system gets out of balance, and sometimes that mite infection just explodes.
Okay.
All puppies acquire that mite from their mama, but they usually don't show symptoms. If they show symptoms, they're usually mild. And Demodex typically is not very itchy. So just seeing that picture and seeing those dogs hanging out with your ducks, that they could have acquired a parasite from the ducks or the chickens. And they're different types of sarcoptic mange mites that affect different species, but when they're in close contact with each other, they can transmit it. So in a situation like that, it's really hard to know what it was. You know, what I would do if you brought a puppy in, I would do a skin scraping and look for it. And then we'd know how to treat it. But nowadays, with some of the medications that are used for flea control, and I don't know if you used anything on the mama or the puppies for flea control, it can treat for those parasites as well. And so a lot of times,
I gave her the chewable for ticks and fleas and all that, and it went away.
Yeah,
and
that's right. And so it certainly can do that. So there's one called Bravecto that will treat for Demodex, even though it's
that's what she took.
Is that what
you took? The puppies were too young.
Yeah, you probably treated them for you didn't know it, but you probably treated them for that mange.
Yeah, and the puppies were too young, and so after they got over 6 weeks, I bathed them in a mild solution with the mange shampoo, and I did that. I did it one day, and then I waited about 4 or 5 days, and I did it again, and they got better. So
yeah, who knows what type of mite it was, but it was probably some sort of mite.
Okay.
You know,
so
and the challenge is, you know, will it happen again? I don't know if you had the female spayed or not, but if it's Demodex,
she is now.
Okay.
Yes, she is now.
Yeah.
All my females are spayed. But you said that we can scratch our eyebrow and there's probably a mite there?
I said if I did a skin scraping on your eyebrow, I might find a mite. Yes. We have them on our skin. It's all God's creatures got Demodex.
Oh my gosh.
It's a reality. It's what you don't know that is better left unknown sometimes.
Yeah. Well, are there any other questions? We are at the hour, but if there are questions. And if there are not, Dr. White, I also just want to acknowledge Dr. Felix Vega, who is another veterinarian who is very involved with us. He's on the call. He's out of San Francisco.
Nice.
There he is. Yes.
Hey, nice to meet you.
Nice to meet you as well.
Yes. And besides our wonderful youth community that's on, Delenn Mayer is out of Idaho, and she has an amazing cat rescue. And nice. Delenn, I want to thank you for being on.
Yeah.
So, do
you
want to share
anything? Thank you so much
else?
for the opportunity to talk with you guys. I've enjoyed it. It's always fun to talk about dermatology. And you know, if the young folks have questions later on, you guys can shoot me an email. I'm happy to answer them.
Fantastic.
Good. Dr. Wells, anything else before we close out?
I am just super happy to be reunited with my fellow The Ohio State University colleague. It's literally been since I left OSU.
Yeah. You were on fire to move to Paris, girl. I remember
That's
that.
right. That's right. You got to come visit me here.
I do. I absolutely do. I will never forget our having those lunchtime lessons in French language with that tutor. That was so much fun.
I know. All right, I think we're done. I think this has been fantastic. Thank you so much, Dr. Patricia White.
Thank you.
And we're going to have
Thank
you
you.
back to talk about your Chinese veterinary medicine.
Oh yeah, absolutely. I'm happy to talk about traditional Chinese medicine. That's my other passion. So I try to blend the two. And it's a lot of fun.
We'll bring you back.
All right. Have a good weekend, everybody.
Well, thank you, everyone. Thank you for being on. You were amazing, and we learned so much. I've got some things to look out for because my chickens, dogs, and cats all fight over the straw that's in my barn, and one lays after the other.
And I was going to say
lesson.
the straw would be the source of passing that infection from one group of animal to the next. So yeah.
Okay. Well, thank you. Thank you, Dr. White. We appreciate you so much. Thank you for listening.
Bye-bye.
Everybody have a great weekend.